Good morning, and thank you very much for watching this presentation. I'm going to talk to you about our new Torbay chart for COVID-19. The talk is divided into 5 segments. I thank Dr. Matt Hawkes and the HCI team for helping me to develop the concept of Torbay charts. We all understand shared decision making intuitively, and there is very good evidence to support this. Decision aids are the key elements needed for an effective shared decision making. What are the benefits of PDA in shared decision making? Patient decision aid increases the knowledge of the patient, improves their compliance to a chosen treatment, and as there is ownership in the decision making, there is less regret, complaints, or litigation. There is also good evidence to support that a well-informed patient tend to choose less invasive treatment and hence cost saving. In our pilot with 110 patients, 4.7% patient who came in expecting to be listed for surgery chose less invasive option. The most important benefit is that patient feels included in the discussion about their health care, especially when importance is given to what matters to them. There are numerous decision aids for each conditions, and here are some examples for those with knee arthritis. However, as far as I am aware, there is no decision aid or an educational aid for COVID-19. The information we get is usually from a reliable web source including gov.uk, NHSE, or Public Health England. What are the unique features of Torbay charts, and how does it differ from other PDAs? The key feature of Torbay chart is that it gives a map for the entire journey for the patient with key waypoints in their journey. The treatment options is given out in a single A4 sheet as an overview. Here, all the treatments are displayed in a logical way with increasingly complex one mapped for more advanced stages of the disease. Once diagnosis and staging is completed, discussion regarding appropriate treatment choices can be done. Let us see how the same chart can be used differently for 2 different patients in different stages of the disease. Here, the patient A enters the treatment at a much early stage of the disease. For this particular patient, simple and less invasive treatments would be the most appropriate choices to consider. Whereas patient B enters the treatment at a much later stage, and here more invasive treatment including knee replacement may have to be considered as a treatment option. In addition to appropriateness of the treatment, Torbay charts on the web version allows patients to compare treatments side by side in a fashion very similar to comparing a product on a comparison website. Now, with regards to COVID-19, is there a need for a decision aid? Patients get their information from reliable websites anyway, but I believe that navigating these websites are rather challenging for many patients. Allow me to discuss few things with you. First of all, please watch this short video clip from BBC.
About a day ago, I had a notification that says that I've been near someone who has coronavirus symptoms. It said read what to do next and then follow this advice until the 2nd of June. When you tap on it, what you get is the basic government, if you can see that, the basic government guidelines for everybody. So there was no talk about self-isolation for 7 days, just following the basic requirements, which I'm already doing.
Yeah, I imagine after all these weeks you could almost recite them off the top of your head.
Pretty much, yes.
What would you have expected to have been told?
I would have expected to have been told to self-isolate for 7 days.
As you can see, this lady is displaying her frustration in not knowing what to do next, and more importantly, she got the self-isolation duration wrong, unless of course she was already showing signs and symptoms of COVID. I'd also like to share a couple of stories. One of my colleague's family member became breathless and fainted at home. She was brought to the accident and emergency. She was examined. Diagnosis of COVID was made. She was told that she did not meet the criteria for having a hospital admission and was allowed to go home. When I asked my colleague what instructions were given for her to monitor her at home, he said not a lot, and they were told to return back should her symptoms get worse. My second colleague's son studies in a university in Madrid. He returned back to UK just before lockdown, but my colleague was trying to find out the rules of self-isolation for his son as well as the family, wading through a maze of information in the gov.uk website. Unfortunately, he found it very difficult to understand what would be the most appropriate thing to do. So in essence, what we really need is some sort of Rosetta Stone that will translate the complicated and information-heavy websites into a simpler form where one can navigate sensibly and learn about self-care and various information about things that matter to them. This is where the philosophy of Torbay chart could be applied and help the patient and their healthcare practitioner. Now here is an example of the Torbay chart for COVID. This is not the final version. As you can see, it follows the same principle by dividing the chart into 3 segments with diagnosis at the start, showing nearly 80% of the patients will have no or mild symptoms and tend to get better, and reassuring them. It segregates the self-help information into 6 logical and appropriate groups, and different aspects of the self-help treatment are described in greater detail. Any red flag signs that needs to be kept in mind and help should be sought for these are placed in the next segment. Deeper layer simplifies the information given in the authoritative sources like gov.uk, etc., and enables the public to navigate that information. Additionally, we have also included some home monitoring guidelines which can help a lot of patients. It thus provides a single point of access to all relevant information and places them in a logical fashion for easy navigation, and therefore the patients can process this information better. The strength of the Torbay chart is that it can support patients who are symptomatic to be confident enough to self-care, but also provide guidance on when to seek help. It can help the healthcare practitioner, GPs, etc. to provide remote guidance to their patient. I see a lot of value for everyone who could use this as the lexicon to decipher the plethora of information that patients get bombarded with regarding COVID. The concept of website has been demonstrated to our Trust Senior Clinical Management Group, including GP champions, and this was very well received. It was also presented to the Southwest Academic Health Service Network's Expert Patient Advisory Panel and received excellent feedback from all the 12 patient experts. I thought I would inform you at this stage to see if there is any avenues by which you could raise awareness for Torbay chart COVID version and to spread this wide. Torbay chart has been developed in collaboration with a trust partnership venture with Health and Care Innovations, or HCI. HCI are currently working with innovation lead of the NHSX. We are now seeking funding to complete the creation of a comprehensive web-based version and support the spread and adoption. We have various ideas to improve each of the sections, including creating appropriate videos and animations to engage patients. One such example is here.
What is social distancing and why should we practice it? If you are infected with the virus, you will shed it when you sneeze, cough, or talk loudly. The virus can travel for a distance in a droplet. It can then spread to a person directly, or the droplets may fall on objects used daily. A person may catch the infection from these. If you are standing close to a person, then you can easily spread this in a droplet. However, if you stand at a reasonable distance then this transmission is minimized.
Thank you.